You did wonderful. Much better than I deserved. Thank you. Thank you. Thank you very much, and good evening to you all. And thank you, Emerson, for those overly generous remarks. And might I add my congratulations to those who will be honored this evening, Betsy Hall and Janet Monroe, to the memory of Libby Dorrell, and to the First Presbyterian Church of New Vernon and St. Peter's Episcopal Church in Mountain Lakes. Congratulations to all of those who will be honored this evening. I'm pleased to be here with all of you as we work together to address one of our nation's most pressing public health challenges, the state of mental health care in this country and accessibility to high-quality treatment. I thank the Mental Health Association of Morris County for your work, and especially for what you do every day on this critically important issue. Too often we are reminded that our nation's mental health care system is not working nearly as well as it should. Many hide behind the curtain of shame and insecurity, while many others lack access, assistance, or even information on how to receive treatment. It can be a vicious cycle where the vulnerable who need the most care are instead left out of society, unemployable, and in some cases, a danger to themselves and perhaps to others. Recent data suggests that fewer than 1/3 of Americans with diagnosable mental illness actually receive the treatment they deserve. Experts also estimate that more than half of those who suffer from severe mental disorders do not receive treatment in any given year. And at least 25% of returning troops from Iraq and Afghanistan will experience some type of mental health challenge. We owe our servicemen and servicewomen and veterans this effort to get them the care they need and deserve, ladies and gentlemen. I am proud to have worked with Congresswoman Doris Matsui, a Democrat from Sacramento, California, in authoring the Excellence in Mental Health Care Act, legislation that will put community mental health centers on more equal footing with other health centers by improving quality standards and expanding access to care. The Excellence in Mental Health Act will give community mental health centers the opportunity to expand their services and obtain necessary designation to provide 24-hour psychiatric care and better integrate physical checkups with mental health services. Congresswoman Matsui and I fought hard and worked with our colleagues on both sides of the aisle and on both sides of the Capitol, both the House and the Senate. And I am pleased to say that the President signed much of our bill into law and created an exploratory phase that puts in place experiments on the state level. It is our hope that the experimenting states will serve as a launch pad to expand the policy to all 50 states. I'm also proud to be working with Congressman Tim Murphy of Western Pennsylvania, a PhD psychologist who has been using his expertise to guide a serious discussion in the House Energy and Commerce Committee, a committee on which I serve. His action, Helping Families in Mental Health Care Crisis Act, where I am a co-sponsor, takes a clinical approach to supporting families and individuals undergoing sudden or long-term mental health crises. The bill targets programming resources on psychiatric care for patients and families most in need of service by increasing inpatient and outpatient treatment options and updating the legal framework to help families and physicians make informed decisions. The bill views those who need care through the mental health lens, not just the criminal justice system. For more than a year, the House Energy and Commerce Committee has examined our current system and found that it is a confusing patchwork of community clinics and state hospitals chronically short of funding that leaves millions of people with mental illness without treatment, often unemployed, homeless, or imprisoned. The Helping Families in Mental Health Crisis Act seeks to improve the mental health care coverage in this country through accountability, results-oriented research, and meaningful prevention. It is my hope that this legislation will become law in this term of Congress. Ladies and gentlemen, this is how Congress should work, together, on issues that make a lasting difference. These bills will help struggling families who seek the best care for their loved ones. It will help those who fear the stigma of asking for help to get the care they need, and it will give our servicemen and women and veterans the care they deserve. And our work on these bills is part of a larger conversation on improving mental health care as a broader effort to reduce what troubles this society. People are passionate about these issues, and it's important to find common ground where it exists. I want to thank all of those who are in this room. You are all advocates in this great cause. I accept this award tonight for all of you, for your loved ones, and for all who are involved in this effort, not only here in New Jersey, but across the United States. Your commitment and dedication is unyielding and inspiring. To Lou, to all involved here in Morris County, and to all of the advocates I see in my office in Washington, week in and week out, year in and year out, let us continue the fight together, and I know we shall succeed. Thank you very much, ladies and gentlemen.